I think you might be sharing your time with Deputy Connolly. Deputy McBarry. Okay. Is it 7.5 minutes each?
Probably in a bit less than that. Thanks, Chair. And I'd like to congratulate the Minister on his new post. Hopefully he won't be called Chopper Harris after a famous footballer for his cuts and so forth. Yeah. Chair, the crisis in the health service is now universally accepted as a fact, with a good reason. Waiting lists and trolley queues are not a seasonal aberration, but are now a permanent fixture in the Irish health service. The state of mental health service staffing after 10 years of vision for change is a national scandal. It's extraordinary then, Ciancurla, that the government's acceptance of this crisis is still in doubt. The publication of the revised health estimates shows that the government, who have presided over the health service crisis for the last 5 years, now seem to be stuck in denial. In the past 5 years, the Fine Gael mantra was more for less. First James Riley, then Leo Varadkar expect us to believe that the cutbacks in health funding would do no harm. A child could have predicted this, and of course patient support groups and staff representatives told the government that devastating effects of austerity cuts on patient care, but all this advice fell on deaf ears. Less service for less funding would have been bad enough, but of course Fine Gael wanted to introduce the market and the private for-profit sector. Their answer for everything, so we got even less service for more money. Because of the additional $5 billion spent on health insurance and the out-of-pocket expenses, Ireland has ended up with the above EU average spending on health, but below an EU average for equality. That is, we get less for more, not more for less. Fine Gael and Fianna Fáil have misled this country about our health service, and they continue to mislead this country. All through their time in government, Fine Gael lectured the left on costing, insisting that the figures for alternative health proposals did not add up. But they themselves never costed their flagship health policy of UHI, Universal Health Insurance. Fine Gael introduced this UHI policy for private for-profit health insurance in 2009 as Fair Care. They announced it as their policy in their Fine Gael general election manifesto and the programme for government in 2011. But when they finally outlined the policy in a white paper 3 years later, in 2014, they still hadn't costed it. They couldn't say how much the health insurance would cost, nor what it would cover. So, Ciancurla, have Fine Gael learned a lesson from this? I doubt it very much. The roughly €500 million increase in the health budget announced in the revised estimate is almost entirely consumed by the current real spending in health. This is not an overrun, as the government have are claiming. The health budget in 2008, that is 8 years ago, was the same €13.6 billion as it is today after the so-called additional money. Inflation in the same period in Ireland is cumulatively more than 30%, and the population is increasing in number and age. This means we now have less spending on healthcare than ever before. The smoke and mirrors of health funding continues. While the overall budget increases by just 6% year on year, the Minister has increased spending on consultancy fees in his own department by a whopping 96%. Given the level of public concern and outcry about the neglect of mental health services, the failure of this Minister to address mental health is pretty amazing. The staffing of mental health is only 3/4 what it should be, and only half the recommended level for children's mental health service in Ireland. Despite this, while the overall budget has increased by 6%, the mental health budget has increased by only 2%. In the revised estimates, the €35 million noted as not yet allocated for new developments in mental health is described as additional funding. But even when it is added in, the total is no more than the general increase in the health budget. The level of funding in mental health in Ireland is only half what it should be in international comparisons. That it is €800 million in a deficit. In primary care, while the announcement of developments in primary care speech and language and psychology service is welcome and overdue, it is dismaying that no specific funding or staffing targets are addressed. In conclusion, Ceann Carla, while the Fine Gael are saying recently that they are committed to developing a one-tier publicly funded health service, confidence is not inspired by the failure to be honest about deficits in capacity in staff, in hospital beds and in primary care centres. Continued talk of superficial fixing through buying and selling care in the National Treatment Purchase Funds and the setting up of hospital trusts can only lead public representatives like ourselves to conclude that Fine Gael, supported by Fianna Fáil, are still up to their old tricks. It's now time for the Minister to stop spinning the numbers and address the staffing and funding crisis in our health service. Thank you.
Thank you, Deputy.